everyone. My name's Jessica Sterner.
My name is Danielle Yantis.
My name is Logan Fluty. Thank you for joining us. This project is Autism Spectrum Disorder Screening Practices in Rural Central Missouri. The three of us are Bryant Scholars, which is the pre-admission program within the Rural Scholars Program at the University of Missouri School of Medicine. As a part of our third-year requirements, we had the opportunity to complete several clerkships in a rural community. All three of us completed family medicine and pediatrics in Sedalia, Missouri. This project was created as a part of the Rural Track Community Integration Program, which serves to more fully integrate students into the community, promote community service, and impact local needs. During our time in the Sedalia clinics and through conversations with providers there, we recognized that developmental screening and autism spectrum disorder screening may not align with current guidelines. Therefore, with this project, we decided to focus on quantifying the ASD screening practices in Sedalia with the ultimate goal of improving patient care in the community.
Autism spectrum disorder is a pervasive developmental disorder with core deficits in social communication/interactions and restrictive/repetitive behaviors that affects approximately 1 in 59 children in the United States. The American Academy of Pediatrics recommends screening for ASD at 18 and 24-month well-child checks using an autism-specific screening tool. The AAP also recommends performing developmental surveillance at all primary care visits. The modified checklist for autism in toddlers revised with follow-up is the most commonly used ASD-specific screener. Providers who use this two-stage screener can be confident that the majority of positive screening results warrant further evaluation and referral for early intervention. Multiple studies have identified the utility of early interventions for autism spectrum disorder, and although ASD-specific screening is recommended by the AAP, current data suggests that few providers actually follow these guidelines, with one study finding that out of 481 family practitioners and pediatricians, only 17% followed the AAP screening guidelines.
We are currently conducting a retrospective chart review in which we are analyzing 300 well-child checks that occurred at ages 18, 24, and 30 months. These well-child checks took place in the Bothwell Regional Health System in Sedalia, Missouri. The well-child checks were performed by family practitioners, pediatricians, and nurse practitioners. We are currently collecting data on utilization of developmental screening methods, autism spectrum disorder screening methods, refer following positive screens, therapies initiated, patient demographics, and type of healthcare professional seeing the patient. One of the reasons we are performing this project is that we identified a paucity of autism spectrum disorder screening practices, as well as a lack of developmental screeners performed during this time in the community clinics. Some of our desired future impacts are to have routine MChat utilization, timely identification and intervention for children who are diagnosed with autism spectrum disorder. Following the results of our study, we plan to present our data to the providers in the area. We will then evaluate provider barriers to care and utilize assessment of barriers to tailor intervention to provider needs.